COVID-19 has disproportionately affected vulnerable populations. Nationwide, infections are 3 times more common among African Americans and Latinos. However, the ultimate source of this disparity remains unclear. Our paper uses mobile phone geolocation data to understand the source of COVID-19 disease transmission in New York City and the racial and income disparities from this risk exposure. We identify 2 key variables that predict COVID-19 hospitalization rates. The first is time spent outside of home. Here in Manhattan, we find many individuals who are able to work remotely in non-essential work, lowering their transmission risk. But things are very different in Queens.
In these outer boroughs, Black, Hispanic, and lower-income individuals are more likely to be engaged in essential occupations which require continued commuting to work. We find that the resulting mobility patterns place individuals at substantially greater risk of contracting COVID-19. A key advantage of our analysis is that we are able to isolate mobility changes and hospital visits at the individual level, controlling for other important neighborhood characteristics. We find that vulnerable populations are also at greater risk due to a second channel resulting from housing overcrowding. We measure the density of residents within buildings in New York City and find housing overcrowding predicts COVID cases and hospitalizations, also showing signs of racial and income disparities. A key implication of our work is that population density alone is not the only factor behind the prevalence of COVID-19 in urban areas. Instead, there are structural inequalities that lead disadvantaged groups to disproportionately live in crowded housing and specialize in jobs that require physical presence. These underlying inequalities in job presence and housing create temporary pockets of density through which the SARS-CoV-2 virus propagates.